This is an e-Psychotherapy podcast on the topic of solution-focused therapy. Our special guest today is Maat MA. Mark, it really is a pleasure to have you here today.
Thank you for having me.
Mark, solution-centered therapy is one of the approaches we use to help our clients or patients in our e-Psychotherapy services. And this is one of the reasons why we became interested in talking to you as someone who has expertise in this type of approach.
Thank you for having me. It's a pleasure.
Mark, for those in our audience who may not know you yet, could you please introduce yourself and tell more about who you are?
As you mentioned, my name, Maat MA. I'm a social worker from profession, master's degree in social work and communities. And I have been working in this field of social work in shelters, within youth care, within mental health service, in local teams, in little cities. So working with adults, working with children, working with families, I've came across solution-focused therapy. And it is really the way that I wanted to work from that moment on, because I think it's very effective. It's quite simple in modality, and it's really good for clients, I think.
Thank you, Mark. Due to your experience, maybe you have been trained in different approaches for helping people. Could you expand on what these approaches are?
Oh, I've been trained in several approaches, but the approaches that resound with me are the more strength-based approaches.
Mm-hmm.
And it resounds with me best because I think it's similar to my character and to my outlook on life, to my ideas about people, as I always think that it's very useful and very important to find out what resources people have, and also to be able to talk with my clients to find out how did they cope with difficult situations in the past before they came to ask some help from a social worker or a psychiatrist or whatever. Because I think everybody is confronted in their life with problems, with difficulties.
Mm-hmm.
And not everybody is always going to find help with a social worker or with a psychiatrist or a psychologist. So people have their own means of solving problems.
So how is it that you ended up becoming a practitioner of a solution-focused approach?
Well, I think in hindsight, looking back at my career and the way I worked, I think I've always have done my work in a more solution-focused way. Even before I knew about the solution-focused approach, about the theory, about how it was developed. So that's why I think it's really congruent with the person I am. And therefore, for me, it's quite natural to work from that stance. So when I came across the first time I came across this, I was a family supervisor in youth care. A long time ago, I think maybe 25 years ago.
Mm-hmm.
There was this book presented from Imso at my work. At that moment in time, I bought the book, but because my work was so busy, I didn't really pay attention.
Mm-hmm.
So it took a few more years to reconnect with this approach, with these ideas, with this theory, you can say.
Mm-hmm.
And then I started to read more about it. I bought more books. I went to conferences, and then it clicked, Then I said, well, this is the other way. It's not how I like to work with people. Because the way I was traditionally formed,
Mm-hmm.
which still is quite dominant way of working, at least here in the Netherlands. Still, a lot of approaches are based on the medical model. Somebody comes to you with a problem or more problems, or somebody sent to you. So then we want to know what is the problem.
Mm-hmm.
The approach says we have to make an analysis or a diagnosis. So we want to know how did it come about. And then when we know when it comes about, then we think of an intervention to solve the problem. And for me, then it's really, the next step is really problematic, because then if we, the experts, social worker, psychologists, or who might it be, have decided what intervention is needed to solve the problem,
Mm-hmm.
then we have to talk to our clients and tell them, this is the way we're going to work with you. And sometimes these clients say, well, I don't think so.
Mm-hmm.
And then we think, we need to motivate our clients for this intervention. And if you're talking about the solution focused approach, it's nothing like that. It's not like me as a practitioner is the expert of to find out what intervention is needed so the problem can be solved. And that's what attracts me to this model, to this way of working, because I believe people have possibilities, people have solved problems in the past, people have resources. So I think it's more about helping them reconnect with their resources, reconnect with their skills to solve problems. And it's not about me as a practitioner being the hero. It's about the client being the hero.
Mm-hmm. So if you had to explain to a child what solution-focused therapy is, how would you explain it to a child?
I wouldn't. I would not.
Why?
Because I think it's more important to practice solution-focused than to explain it. I mean, if somebody would ask me, I would answer, of course. But in reality, is like I said, it's actually a quite simple model. It's not easy to do it, but it's quite simple model. So in fact, it's just about asking questions. I go to somebody, I just ask a question to them. If we have a conversation today, so I would ask them, so what should we talk about today that would make this conversation useful for you? And then they will tell me what they want to talk about. We have a conversation about that. And then I would ask questions about what they told me. It really is about what outcome they want to achieve, right? So my questions will be directed at helping them to making steps towards this outcome.
And who decides what the outcome should be in this approach?
The client. It's not me. They want to change something. I mean, people who have a problem, they go to somebody. What they want is to have a situation where the problem does not exist anymore, or at least will be not so present as it is. They want to change something. And me as a practitioner would want to ask the client, if the problem doesn't exist anymore, what would be there instead? There has to be something else, So for instance, if somebody says to me, I have really difficulty in sleeping, for instance. I mean, I'm not a general practitioner, but they could, come and talk to me and say, I have really big difficulties in sleeping.
Mm-hmm.
So then I would ask them, okay, if you wouldn't have this problem anymore, what would be there instead? So then they will tell me what there will be instead.
Mm-hmm. Instead
is not like I don't have any difficulties anymore in not sleeping.
Mm-hmm.
It has to be something that can be worked on. Where they say, well, I've seen you a few times and now I don't have to come back anymore because I'm really sleeping well, So that's the first part of it. But the question one could ask after they say, I'm having good night's sleeps now, I would ask them, what difference would it make in your life if you're having good night's sleep? What has changed?
Mm-hmm.
Because I think, in fact, it's about not the goal they want to achieve, but it's about what is different if one has achieved their goals.
Mm-hmm.
If they have achieved their goals, what difference would that make in their life? So, for instance, if they say, well, now I'm having really good night's sleep, then it would be interesting if they could think about and express how having good night's sleep affects their life. What changes does that bring about? Because before they didn't have good night's sleep, which was a problem, and now the problem is solved, and it will have some effect on their life. It's not for me to decide, but they can tell me. And often it's about that they will say, well, if I'm having good night's sleep, I will feel better, or I will have peace of mind, or me and my wife are doing much better together, things like that.
Mm-hmm.
And that's what I like about the solution-focused approach, because it's not only about solving a problem. Actually, it's not about solving problems. Actually, it's about achieving something else. People are creating, actually. They're creating in their life something different maybe than before, but something that they want to create. Probably not that they knew this before they come to see a practitioner, but by asking certain questions, which will make them think more and more about certain things, they will come up with certain solutions, ideas for their future. And that's what I think is very interesting. And also that it can be achieved in quite few sessions.
Okay. Mark, do you think professionals need to be trained in this type of approach to use it when they help clients? Or is it enough to be a clinical psychologist or a social worker or a mental health professional to provide clients with solution-focused therapy?
I don't think practitioners need to be trained in this approach because there's a lot of approaches that people can use. I'm not saying this approach is better than other approaches. But if a practitioner wants to use this approach, it's a good thing if they will be trained. You can buy a book, you can read it, and like I said, the model is quite simple, but that doesn't mean that it is easy to practice. It's quite difficult to practice because it's such a simple approach. One could have the idea because the model is quite simple, that it would be easy to do it, but that's not the case. So I think if you want to use the approach, I think it's a good idea to get training.
Okay. And what would you say, Mark, is the setting or the professional settings where you have mainly applied solution-focused therapy?
I'm a social worker. I'm not a psychologist, right? So I wouldn't say that I'm a therapist. I wouldn't say that I applied it in a therapeutic way. But I do think that using this solution-focused model has therapeutic effect, right? And I used it in all my conversations with clients, be it in the mental health service where I worked, be it in youth care, be it in local teams where I work, because people have problems. People come to practitioners, psychologists, psychiatrists, because they have a problem. And they want, when the problem is big enough, when they are really struggling too much, then they will go and see somebody. And then they want to solve it in some way. But like I said, you can solve problems in different ways. You can use CBT or other therapy, but solution-focused approach is effective. There's a lot of research about it, that it works. And what I like about this approach is that it's really concentrated on what works for people, right? So actually, if somebody comes to me and say, I have this problem, but I don't want to tell you about my problem, that's okay. I don't need to know your problem. What I want to know is if we are going to talk to each other, what do you want to talk about? What do you want to achieve by talking to me? What is the outcome that you want to have at the end of our conversation? And if somebody can talk to me without talking about their problem, that's okay.
Mark, you have already mentioned that this type of work with clients can be done in a few sessions. Would it be possible to have as well a long-term set of sessions with clients under this type of approach?
Yes, I think it can. From the solution-focused approach, if you use it really as it was meant to be, you're not going to make a plan about how many sessions you're going to do. You're just going to do a session. And then at the end of the session, the client can decide if it was good enough or do they want to come back for another session. And if you look at it that way, then they might also come back another time, and maybe 20 times or whatever. It all depends. But it has to be from a perspective from the practitioner. You want sessions to be useful. So it shouldn't be like people want to come back to you because they are used to talking to you. It has to have some use. But I think it's quite possible that people come back for a lot of sessions in a certain situation. But I think solution focus, especially if in a therapeutic sense, can be done in 3-4 sessions maybe. But like I said, it's not a therapist that decides how many sessions. It's the client that decides if they want to come back.
And if the client was asking for the therapist to decide that, if they said, I don't know how many sessions, how could I know how many sessions?
I wouldn't ask them to tell me how many sessions they want. I would just ask them after a session if they think they want to come back for another session.
And what if a client asked you the question, how many sessions will this take?
I think it will depend on the conversations we have had before. I'm not really inclined to give an answer to that question because I wouldn't know. So perhaps I would say, I don't know. It all depends how our conversation will go. I mean, if we have a conversation and the client achieves what they wanted to achieve from this conversation, it's quite possible that after one conversation, it's done, right? But another answer that I might give, if somebody asks me this question, how many sessions do you think I need to have with you? I think I would ask them, so if I would give you a number of sessions that it might take, what difference would it make for you to know this?
Mark, and in other sessions that have been published on the web with you, you have mentioned your work with single sessions.
Right.
Many people would question that psychological or behavioral change could take place with only one session.
Well, actually, there is research about this. I joined a conference some time back, and Professor Michael Hoyt, who was one of the attendees at this conference, explained that research shows that the most sessions clients come to therapy are 1 or 2, which doesn't mean that some clients don't come for like 20 or more, but the most sessions people come to are 1 or 2.
Mm-hmm.
Most clients think they don't need to come back after 1 or 2 sessions.
Mm-hmm.
So if you practice one session therapy, which is a real thing, and it's done in the Anglo-Saxon world for like quite a long time now.
Mm-hmm.
So if you can have one session with the client and the result for them is good enough for them not to need to come back for another session,
Mm-hmm.
that's okay, right? And one single session therapy doesn't mean that it is impossible to come back for another session. It just means that you offer this one session to them and that you are thinking that in one session you can do therapy with a result for the client that will be satisfactory.
Mm-hmm.
And there is this connection with solution-focused therapy because solution-focused therapy also does not show that you need to know how many sessions you have to go. In solution-focused therapy, the idea is that every session can be the last one.
Mm-hmm.
It's on to the client to decide if they think they need another one.
Mm-hmm.
So if you have one session and after one session, the client will say, well, thank you very much. I don't think I need to come back. That's okay.
Mm-hmm. Mark, what can you tell us about the efficiency of solution-focused therapy? Would you say that solution-focused efficiency or effectiveness is higher or lower or equal than other approaches for helping people?
Well, according to research, there's been a lot of research about the solution-focused approach and compared it with other approaches. Research has shown that it is as effective as other approaches, but it's also done in less sessions. There's good reason for clients for practitioners to practice solution-focused therapy, I think. But other approaches work as well. So, there's not one therapy model that is better or best or things like that.
Mm-hmm. And what would you say is the difference between solution-focused therapy and other approaches to help people which are also resource-oriented?
Well, I guess if you don't work with clients to find out their resources, then it's quite difficult to find a solution. But the difference of solution-focused approach and other approaches, I think, is that solution-focused approach doesn't try to fix a problem. Solution-focused approach is working with the client to create a new perspective, right? Mm-hmm. So in solution-focused, it is said that there's not a necessary connection between the problem and the solution. So you can find a solution or a new perspective, which is not per se connected to the problem the client came with. But if you create this new perspective, mm-hmm. the problem will diminish or disappear without really focusing on the problem. So I think that's the main difference. Mm-hmm. And of course, it's important to work with the resources of clients, work with their ways of coping.
Mm-hmm. Can you give us some examples of what people's resources can be and ways of coping can be?
You can work with the client and ask questions about what was the last time that they were confronted with a certain problem and how did they solve the problem? What did they do? How did they manage to solve the problem? What possibilities do they have or does their network have? Or what characteristics do they have that made it for them possible to get out of that difficult situation? And sometimes people will say, I don't know. But if they did solve it, they will know. You need to be persistent in asking them these questions. So they will come up with answers that will help them to recognize their resources. And if they recognize their resources, which they might have forgotten because of the situation, if they can recognize these resources, then there is a bigger chance that they will again make use of these resources, right?
So what are resources? Are they abilities people may have? What exactly are resources?
Yes, resources are abilities, are qualities, are characteristics, but they also can be things like somebody that is helping them in certain situations, like an uncle or a football coach, or, it's up to the client to tell me what their resources are. I cannot tell them what the resources are.
Mm-hmm. Mark, I am thinking on people who may be currently considering taking therapy. Mm-hmm. What advantage could they find if they started solution-focused therapy sessions?
I think there are a few advantages if they really want to solve their problem. The client has a problem, goes to a practitioner or a therapist or whatever. And then from a solution-focused approach, the first question is to ask them, what do they want to achieve with this conversation, with this therapy? The therapists from Brief in London have found this really great question that they are using all the time, which is, what are your best hopes for our talking? So they will ask the client, what are you hoping that you want to talk to me about today? And then they will talk, probably will tell about the problem they have. So the therapist will listen to the story. They will probably acknowledge if it's been very difficult. They might ask them, how did they cope with it until now? But at a certain moment in this conversation, they will also ask, what do you want instead of the problem, right? And then from then on, it will be about what this new situation looks like. If a client wants to have such a conversation, I think that it's a bonus. But if a client wants to have a model, a way of talking, a way of therapy, which would look more like a traditional medical model, if they want to have a diagnosis before they want to go on, then perhaps a solution-focused therapist is not the best one to choose.
Can you give us examples of what those traditional models would be?
Well, for instance, CBT is one model. I mean, traditionally, if somebody goes to a therapist, for instance, that their general practitioner sends them to this psychologist because the doctor thinks the client is depressed, for instance. In certain models, the therapist will first want to make a diagnosis, which is how depressed is somebody, how did they get depressed, what happened before that made them get depressed. In solution-focused therapy, we will not do a diagnosis. We don't research the problem. One could say we research the solution, we research the preferred future. What is it the client wants from this therapy? What do they want to achieve, right? Mm-hmm. Okay, everybody will say, I don't want to feel depressed anymore. Okay, so how do you want to feel instead? If you're not depressed anymore, how does your life look like? I mean, if you're depressed every day, you might think about depression or difficult situations or whatever. It will take a lot of time being busy with your depression, right? Mm-hmm. But if you're not depressed anymore, you don't need to spend all this time with being depressed, right? Mm-hmm. So what will you do instead? What does your life look like if you're not depressed? What will you be? Will you be happy? Okay. If you're happy, how does it look like? What would be the first thing your spouse would see if you're happy? How would they know you're happy, right?
Mm-hmm. And Mark, what would you say are some of the limitations of this type of work, some of the limitations of solution-centered therapy? Are there any, or what would you say are the disadvantages of solution-focused therapy?
Well, I remember I once listened to an interview with one of the therapists from Brief in London, who told in the interview that there was this lady coming to see him. So he asked her his question, what are your best hopes for this talking? And she told him she wanted to talk to him about dying. And then he said to her, I don't do dying, I do life. And then she said, okay, if you don't do dying, life would do. So then they have this conversation about her life, right? There are so many different models in therapy. Mm-hmm. So not every model is for everybody. If somebody comes to me, has a session with me, and they're not convinced that it's for them, that's okay. I can maybe refer them to somebody else. That's okay. If somebody else can help them in a better way, then that's fine. Mm-hmm.
Mark, some clients and some psychotherapists have criticized the solutions-focused model for being naive and sometimes even unrealistic because problems are not considered, and in most cases, problems do actually exist for people. What would your answer be to this critique?
Well, solution focus is not problem phobic. The difference is solution-focused therapists don't find it useful to really dig into the problem. But if the client wants to tell me about the problem, I will listen because that's important. It's important to listen to the client. It's important to listen to what they're going to tell me. It's important for me to let them know I hear what they are struggling with. Mm-hmm. It's for me important to let them know, to acknowledge that it must have been quite hard to deal with it. But in fact, all therapy models are about change, are about finding a way out of the problem. And in one model, they might say, okay, we need to understand the problem before we can find an intervention. Solution focus is not like that, because solution focus is convinced that the conversation that we can have with the client can co-construct a new reality for the client. It's not me, the therapist, going to tell them this is your new reality. And the client probably needs somebody to help them to create this new reality. But it's like in a cooperation, right? It's in a dialogue, I'm responsible for the questions to ask the client, and the client is responsible for the answers they are going to find, which ultimately should lead to this new desired future.
Mm-hmm.
And in that sense, I think it's a really good model. I think it really works.
Would you say it is possible in life to develop a solution and resources focused mindset or outlook? You mentioned something about this at the beginning of our talk. Would you say that this type of mindset can be developed?
I think some people have these mindsets. Some people have the mindset maybe because of their upbringing, right?
Mm-hmm.
If you're being raised in circumstances that are difficult, but there's always a way to find steps forward. I think that helps to develop a mindset that will look at possibilities, look at qualities, look at what is possible instead of what is not possible. And I think solution focus is about what works, right?
Mm-hmm.
It's like there are a few tipping points that Steve DeShazer wrote about. If it ain't broken, don't fix it, right?
Mm-hmm.
If something works, do more of it. If something doesn't work, stop doing it and do something else, right?
Mm-hmm.
And I think that's quite a nice base to build on your life.
Mm-hmm.
Because sometimes in therapy or in social work or whatever, we are also looking at situations that we think are not good enough, but maybe for the client it's good enough. So if we think it's not good enough, then we might tell them they have to do something else. They have to fix it.
Mm-hmm.
But perhaps for the client it's okay.
Mm-hmm.
And in that case, they shouldn't change that. They shouldn't fix it. Because sometimes it's important also to ask, what are the things that you, even with a lot of problems, concerns, but what are the things that you don't want to change?
Mm-hmm.
As well as to know what you do want to change, but also what are elements of this situation that you, even if it's very difficult, but what are some elements that you want to keep?
Mm-hmm.
What do you want to keep alive?
Mm-hmm. And what would be the benefit of working and doing work on achieving such a mindset, such a more positive and resources-oriented and solution-focused mindset in life?
Well, I think it's very helpful in your life to be able to see that there's always a way forward. There's always hope. At the end of the tunnel, there's always light, how dark the present situation might be.
Mm-hmm.
If you work with people who are thinking about suicide, for instance, people might, when they're thinking about suicide, might have the idea that their life has no sense anymore, right?
Mm-hmm.
Because of the pain, because of the things they experience or whatever. But if you can help them to see that at some point in their future, there is hope of a different future, of a different way of living, that will help them to change.
Mm-hmm.
Being hopeful is a very important piece of mindset that wants to be able to change, to work at change.
And Mark, what would you say to people who are afraid of having therapy sessions?
Why will they be afraid of having a therapy session? I mean, I think from all the different models, I think solution focus would be then the best way to go, because it's not me, the therapist, who decides what we're going to talk about. It's you, the client, who is going to decide what to talk about. So if you're afraid to talk about something, you might be afraid to talk about a problem. But in solution focus, you don't need to talk about a problem. If you want to talk about a problem, that's okay. But if you don't want to talk about a problem, that's okay too.
Mm-hmm.
I mean, if somebody would be my client and they will tell me, I did come here to talk to you, but actually I'm very afraid to talk to a therapist, right?
Mm-hmm.
Then still my first question would be, what are your best hopes for this conversation? So they can tell me what they want to talk about. Maybe they want to talk to me about this idea of being afraid to talk to a therapist. That's okay. They can talk to me about that. But maybe there's something else that they want to talk about, and that's okay too. And from there on, we will build a conversation based on what they bring to the table. And the conversation will always be to discover where they want to go. What is the outcome they want to achieve, right?
Yeah.
But I can imagine that in some models, when this client afraid going to a therapist, we'll need to talk about the problem extensively because that's the issue within certain models. But in solution focus, the focus is not on the problem. Focus is on the solution or on the preferred future, on the outcome of the conversation or the therapy.
Mm-hmm. Well, Mark, I have come now to the end of the questions I had for you today. And I wanted to give special thanks to you for doing this podcast with us. So thank you again. And I hope to see you with Mercedes next time.
Well, thank you. Thank you for the interesting questions. I hope my responses gave some more clarity about my ideas about solution-focused work, about my practice. And I hope for another opportunity somewhere in the future where we might explore it some more. Thank you so much for having me. It is a pleasure. And till next time.